Hello everyone, my name is Mehmet Demirci. I'm living in Istanbul, Turkey. I'm working at Beykent University School of Medicine, Department of Medical Microbiology as an associated professor and head of department. Hello. The world is going through a pandemic period called COVID-19, which negatively affected livelihood, social life, and more importantly, the mental and physical health of billions of people. The COVID-19 pandemic is a global health crisis that defines our age. It spread to all continents except Antarctica since its appearance late last years. While the number of cases increasing every day in Africa and America, Europe has become center of the disease. Now, the number of daily cases in Europe has exceeded the number of peak point cases in China. Every assessment and every step of COVID-19 process will be decisive not only for the present day of the world, but also the problem it will face in the near future. It was understood that COVID-19 caused damage to all organs in which it spread, while the only organ to be damaged in the lung, it should be known that it reached all the organs it has gone through with blood spread. COVID-19 search for ACE2 receptors in the cell, in the organs it reach, and when it finds it, disease formation occur in the organs. This ACE2 receptor is also found in the heart, vein, kidney, brain, and intestine besides the lungs. According to information expressed, Yale University nephrology specialists, kidney failure is observed in 20–40% of COVID-19 patients in the intensive care units. Kidney function is evaluated according to the total amount of work of the functional unit we call glomeruli. The glomerular function rate is calculated various formula based on the creatine level in your blood. More precise measurements are provided by calculation by measuring blood and urine creatine values. When evaluating the amount of kidney function, it is decided by looking at your creatine value, not urea. Presence of protein leakage in the urine while evaluating with protein, microalbumin, and creatinine, presence of cilia and renal tubular epithelium and transitional epithelium in sediment analysis suggests kidney failure. COVID-19 appears to cause kidney failure as a result of reaching the kidney through the blood. In this case, infected patients need to take urine sample, move to the laboratory and work on analyzer. It should be known that the COVID-19 virus constitutes a carrier and infectious risk group is more important than the biohazardous waste categories, and that pathogen may also be spread by air or direct contact with a sample. COVID-19 diagnosis can be performed with serum, blood, respiratory swab samples such as nasopharyngeal or oropharyngeal swabs, sputum, endotracheal aspirate, bronchoalveolar lavage, stool, urine, or different biological samples can be used for nucleic acid detection. It is essential to ensure that laboratories adhere to appropriate biosafety practice to investigate the presence of COVID-19 virus or the platform tests for clinical samples taken from patients who meet the definition suspected case should be carried out suitable equipped laboratories by trained personnel in the relevant technical and safety procedures. In any case, national guideline for the laboratory biosafety should be followed. During the transport of urine specimen with unsealed or uncapped urine tubes and testing on analyzer, there is a risk of virus transmission to the healthy individuals. While focusing on tackling the COVID-19 crisis and its effect, it should be reflect on its method to prevent such a crisis from reoccurring in the future. In the long-term methods, to support countries to prevent, better manage, such crisis should be explored, and it should be ensured that whole world takes full advantage of the lesson learned from the crisis. The DIRUI proposal is our global response today is an investment in our future. In order to keep COVID-19 away from routine laboratory environment, transport of the urine sample with cap tubes, analysis with cap tubes. After the analysis, these cap tubes should be kept in the laboratory environment. Full automatic urine analyzer system to detect dry chemical parameter and shape elements in the size that are most suitable in the laboratory condition by DIRUI are presented to us. DIRUI is one of the fastest manufacturer in the fully automated urine analysis system to meet the COVID-19 pandemic condition to analyze the urine sample that can be taken from COVID-19 patient in the healthiest way and prevent transmission. Transport of the sample with closed tubes. Analysis can be done with the tubes closed. In this way, it's ensured that the tubes can be kept closed and analyzes, and its aim, there is no personal contact in the process from taking sample to the end of the analysis. Flow imaging technique. The special sheet solution wrap the flowing cell, both act as protector and allow the cell pass in the front of the camera in a single layer. Photographing is done with the high-speed CCD camera. All these cell images are classified by artificial intelligence identification technology to provide the same and high-quality analysis in each urine samples. In defining artificial intelligence, beside the basic 12 sediment parameters, the subgroups of the some critical parameters are automatically provided, especially identification of the red blood cell types, subgroup of kidney epithelium, cilia and crystal subgroup, bacteria and yeast type, which are seen of the kidney damage is clinical importance and is intended to facilitate to diagnose various kidney diseases. Albumin is an indicator of kidney damage stage criteria in chronic kidney failure. Compared with the albumin to creatine ratio are more convenient to detect. No need for 24-hour urine collection and easy for collection to detection. When we see the vitamin C resistance, vitamin C can be affect the detection of the glucose, blood, bilirubin, nitrates, and make the result false negative. Through repeated experiment and analyzes the experimental results, we obtain the following conclusions. It's only when the vitamin C content is over reference, then you should pay more attention to avoid false negative reports. DIRUI urine analysis systems have the same brand, originally produced strip, reagents, calibrator, and control materials, and standardization is provided between analyzers. There are different model systems according to capacity of the laboratories. DIRUI provide full capacity service with full automatic biochemistry analyzers, urine analyzers, hematology analyzers, hormone and coagulation analyzers, and can perform all routine tests in the laboratory. For high capacity health institution, models with high speed, high sampling capacity, and high efficiency are available. Also, for laboratories with low volume, have compact, user-friendly, full automatic analysis system that take up less space are also available. DIRUI has important place in the healthcare industry in China domestic market, and also has taken its place among major brands in the global healthcare industry as a manufacturer. Thank you for listening.